unsure whether you have fibroids or adenomyosis? If you have symptoms such as heavy period bleeding, periods cramps, prolonged menstrual periods last more than a week, swollen abdomen that look like pregnant, you have tried very hard but still could not get pregnant, always wanted to go toilet to pee, sometime you feel stomach pain or pressure or lower back pain, then you may be at risk for uterine fibroids or adenomyosis. There are 3 types of uterine fibroids, categorized by their location: intramural fibroids, submucosal fibroids and subserosal fibroids. Adenomyosis is another common disorder that affects women of all age groups. Abdominal approach. It is a safe treatment which is guided by ultrasound image throughout the procedure, ensuring precise insertion of the MWA antenna into the targeted area. MWA uses heat to kill and necrotize the fibroid tissue, and shrink the fibroid without cutting or removing the uterus. It is a very fast procedure, which can be completed in about 15 minutes. The residual fibroids will continue to shrink and completely absorbed by our body eventually. Most importantly, your uterus remains intact with virtually no scarring left on your stomach. MWA can also be treated by vaginal approach. MWA antenna comes with a smart cooling system internally, to prevent the risk of overheating or damage to normal tissue. The whole procedure will be precisely monitored by ultrasound image. A tiny MWA antenna of 1.6 mm is inserted into the fibroids. Activation of microwave energy will heat up the tissue in the fibroids, causing the fibroids tissue to die, leading to shrinkage of the fibroids without removing them. MWA is able to treat multiple fibroids simultaneously. The treated fibroids do not require any removal or cutting. They will shrink as the body absorbs the ablated tissue over time. It helps to regain a functional and healthy uterus. Treat fibroids or adenomyosis with confidence with MWA incision-free treatment. It is a uterus-preserving treatment that leaves your uterus safely intact without scarring. Patient can usually go home on the same day with minimal discomfort and quick recovery to daily activities in a few days, with dramatic improvement from the symptoms and decrease in fibroid size. Isn't it simple, safe and accurate without all the scary cutting open procedures?
Target the microwave, burn the ablation to the uterus. So you can see this is called fundus. Okay, this is anterior surface body. Uterus, it is the posterior surface. So pathology in the posterior, anterior, right? Right. And 20 centimeter, 14 gauge. Now they are treating the uterus. Try to understand. So I told you cannot do surgery for this case. You have to do hysterectomy only, remove the uterus only. Okay? Section up. So that is the reason. Now the microwave play key role. Section up. Because of the disease is bleeding. The inner layer and this of internal connection bleeding here. That is called adenomyosis. From there leaking of blood. So now with the ablation we are stopping the bleeding and then removing the disease. So pain is removed. So bleeding will stop. Then patient quality life. So posterior wall. This is the pathological. I am measuring how much depth I have to go. You see, this level I have to go. You can see the 2 rings over black color. First one, antenna. यहाँ तक जाता है, यहाँ तक जाता है. You don't go behind this, otherwise it goes to the rectum. Posterior left rectum. Right? You see, my target is here. I am doing here, fundal region. You see how is the bleeding. You can see how the bleeding, adenomyosis, so uterine bleeding starts. You don't see See how the bleeding, ultrasound, this bleeding cannot manage. Okay? Yeah. Start. See. Okay. Try to understand how severe bleeding. That is the reason she is anemic.
So 15 seconds.
90 seconds.
90, right?
Yeah. That will automatically stop.
Yeah. It's 1.5 minutes.
Now we can observe over there, it will stop bleeding and it will branching also will be there. And immediately after 10 to 15 days. Right.
And you have preserved the organ also.
Yeah, that's only the method is preserving organs. But it is scanty, low blood, because it's ablated, the tissue is dead and it's endometrium damaged. So it's simply, for example, it is bleeding like a period of 300, 400, heavy bleeding. Now it comes to 10 ml, 15 ml. So the blood bleeding will stop, leaking will stop. So blood hemoglobin level improves. The quality pain will improve. Now water is coming to inside.
Yes.
Not it up. Yeah. Understand? So back camera back. So my target is here.
And it is better to do conservative, being going rather aggressive. You can consider another session in your patient if it is required.
No, it's depending on size. So we preferred actually 6 to 7 centimeter. Above 7, 10 also you can try.
Okay.
But results are difficult, compromised. So we counsel the patient for 2 sessions.
They can think about investigating. क्योंकि डॉक्टर ये ऐसा एक कम्युनिटी है, डॉक्टर ऑन दिस साइड, डॉक्टर ऐसा कम्युनिटी है जो बहुत बार ब्लाइंडली किसी भी चीज में इन्वेस्ट नहीं करता है. They need to think because we need to use it on our patient. We need to find out the best way and best care we can be delivered to our patient or not. So माइक्रोवेव में अभी भी बहुत सारी साइंटिफिक बेस्ड स्टडीज
No, you can see.
We should ready with the advantage of the this thing.
not only advantage, you should inform the disadvantages.
See, the best treatment for this adenomyosis case is what we are used to do, hysterectomy. But scanning report to scanning film सुना है, please scanning film. Come back. Here on my shirt. Right, and then you can get back from that. Why to be here is that it's see. Here we need a radiologist, okay? Now you can see the ultrasound, generally. Okay, explain. I will show you. This moment you can see the uterus totally ablated. You see this, movement? Water, total black is the water. So this is the uterus movement. And you can see clarity, there is white spots.
Yeah.
Yes. नीचे
वो ब्लैक में जो व्हाइट स्पॉट आ रहा है, ब्लैक
छोटा सा in the center.
जो व्हाइट
white spot is ablation, the anterior and posterior one.
The black shadow is of water, is of sunlight is over there.
White spot नीचे है ना?
Yes, sir.
पूरा ablate हो गया. That then you give a contrast injection, see the any residual. So you do Doppler now.
हाँ.
More Doppler.
Doctor Christo.
Yes. Doppler. Okay. See only very minimal blood. You can see the flow. Everything was stopped. If you do earlier Doppler, there are lot of blood vessels, right?
Okay.
Now no. So Doppler is come down. You see. Okay. Right. You can now give a wash. So ultrasound guided. But you have seen how the bleeding, how the ferocious interest.
So that is
We have to be very straight and over to the gynec general surgeon. So the safest method, lab ultrasound guided microwave ablation of uterine disease. That is called lumbo. Interest will be 6 to 7 centimeter. centimeter. Now it is 10 12 centimeter. Okay. That is the reason we are